Cancer is a word that carries a heavy weight. It's a diagnosis that can change lives in an instant. But what many people don't realize is that cancer is not just a single disease. It's a collection of over 100 different diseases, each with its own unique characteristics and challenges. Today, I want to talk about the role of genetics in cancer, a topic that is both fascinating and crucial in our understanding of this complex illness. Every day, our bodies are constantly repairing and regenerating cells. This process is guided by our genes, the blueprints of life. However, sometimes these blueprints can have errors or mutations that lead to uncontrolled cell growth, essentially cancer. These mutations can be inherited from our parents, which is why family history is a significant risk factor. If a close relative has had cancer, your chances of developing it can increase, depending on the specific type. But it's not just inherited mutations that we need to worry about. Environmental factors, lifestyle choices, and even random errors during cell division can lead to mutations. For instance, exposure to carcinogens like tobacco smoke or ultraviolet radiation from the sun can cause changes in our DNA that may lead to cancer. This interplay between our genes and the environment is a critical area of research in understanding how cancer develops. One of the most groundbreaking advancements in cancer research has been the identification of specific genes associated with increased cancer risk. For example, mutations in the BRCA1 and BRCA2 genes are linked to breast and ovarian cancer. Women with these mutations have a significantly higher risk of developing these cancers, which has led to proactive measures like genetic testing and preventive surgeries for those at high risk. This is a powerful example of how understanding our genetic makeup can empower us to take control of our health. But it's not just about identifying risks. Advances in personalized medicine are transforming how we treat cancer. By analyzing the genetic profile of a tumor, doctors can tailor treatments to target specific mutations. This means that two patients with the same type of cancer might receive entirely different treatments based on their unique genetic makeup. This approach not only improves outcomes, but also minimizes the side effects associated with traditional therapies. As we observe World Cancer Day, it's essential to recognize the importance of research and awareness in the fight against cancer. Understanding the genetic factors that contribute to cancer can lead to earlier detection, better prevention strategies, and more effective treatments. It's a reminder that knowledge is power. So, what can we do? First, we can advocate for genetic testing and counseling, especially for those with a family history of cancer. Second, we can support research initiatives that focus on the genetic aspects of cancer. Lastly, we can educate ourselves and others about the lifestyle choices that can reduce cancer risk, such as maintaining a healthy diet, exercising regularly, and avoiding known carcinogens. Together, we can make strides in understanding cancer and its genetic underpinnings. By raising awareness and supporting research, we can help pave the way for a future where cancer is not just a word we fear, but a challenge we can face with knowledge and resilience.